In my opinion, if you actually select the drug in the unselected population, I think clearly you have increased risk of failure. But having said that, because we don't know the mechanism of action of certain class of drugs, I'll give you two examples. The first one is really, regorafenib. It's a very broad multi-targeted kinase inhibitor. There has many putative targets. So, as you know from the recent press release and also their data presented at this meeting, the drug definitely is improving the overall survival in the second-line setting. But we do not know what subtype of patients, what subgroup of patients will actually benefit, from regorafenib more. I think so far the subgroup analysis suggests the drug seems to be working across different subgroups. So you can argue a drug like regorafenib, until we figure out, the biological marker that can predict the efficacy, it may not matter what subgroup you actually apply the drug to. And the other class of the drug that we're actually having a lot of excitement is really the immune-based therapy, particularly the so-called checkpoint inhibitors. We have actually very encouraging data from the ongoing study looking at nivolumab. So far, the clinical experience has been actually expanded to more than 200 patients. So clearly, the drug, single-agent nivolumab, will produce approximately 16% of the response rate in all comers. So meaning, at this moment, we do not know who are those 16%. We don't have a good biomarker. We actually don't have a very good clinical feature to segregate those patients who are likely to benefit from checkpoint inhibition. So you can make an argument a drug like PD-1 inhibitor perhaps will fall into this category as well. We may have to apply the drug for everyone coming into the clinic until we can figure out who are those patients who are likely to benefit from the treatment, or on the contrary, who are those patients who are likely unlikely to benefit from this class of drugs. But so far, we have not made significant progress predicting those subgroup of patients either responding or not responding.